why do you need to talk about connection? Why is connection important? Connection of the people. I said it's the most important thing that we do is to connect with other people. So my why is not doing surgery. My why is to improve the quality of my patients' lives. So that's my why. So when you're very clear with your why, then you can do the procedures. Yeah, by the way, I do implants, I treat infections, I take out teeth, I do bone grafts, but that's not who I am. And that's not why I go to work every day. I go why every day to improve the quality of lives. I need to be good at those techniques to do that. So how do you teach that? Well, this is something I've been talking about with one of my coaches because we're trying to get this information out there.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold press juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences, where a lot of that grit is done. We'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello, hello. I am Dr. Jewel White Williams, and I am here on Cold Press Conversations, and I'm elated. Elated today because I have an incredible guest today. Dr. Michael Sonick is an internationally known, highly regarded authority in the field of dental implantology and periodontology. A full-time practicing periodontist in Fairfield, Connecticut, he is also a frequent guest lecturer in the international program at New York University School of Dentistry and the University of Connecticut School of Dental Medicine. He lectures worldwide on the subject of aesthetic implants, periodontal plastic surgery, guided bone regeneration, comprehensive treatment planning, and the delivery of exceptional customer service. He is the author of the book Treating People, Not Patients, and co-editor of the multi-language textbook Implant Site Development. He serves on the editorial boards of numerous journals, including the Compendium of Continuing Education, the Journal of Cosmetic Dentistry, Inside Dentistry, Dentistry Today, and also writes and publishes numerous papers in peer-reviewed journals. Dr. Sonick is a diplomat of the Board of Periodontology, a diplomat of the International Congress of Oral Implantology, a fellow of the American Academy of Implant Dentistry, a fellow of the International Team for Implantology, a fellow of the International Society of Periodontal Plastic Surgeons, and an Eagle Scout. His mission is to improve the quality of patients' lives, as well as the lives of everyone he meets. Dr. Sonick, how are you doing?
Good. Thank you for having
Awesome.
me on.
Well, I'm elated that you're here today. I just want to let you know that I love reading books. I love reading books. And the reason I read them is because you become more knowledgeable about things. And your book, I think, is going to make a huge difference in how we care for people, how we care for patients, how we respond to people. And a lot of the examples that you place in the book, and I'm doing this because, hey, fans, I got to let you know that it's a quick read. You can get it on Kindle, and he provides so much information that I'm going to be honest with you, it's something that you will walk away learning from. He is an educator, and I just want to make sure you understand that because I focus on instruction, research, and clinical practice. He encompasses all three. And that's the reason why I have him here today. Just give us a little background, Dr. Sonick, of who you are and some of your experience.
Yeah, well, I'm a full-time practicing periodontist, which means that I focus on supporting structures of the teeth as bone, soft tissue. But I'm also a dentist, and I like to say a physician of the oral cavity. I focus on oral systemic health and treating the patient's whole body. And I've been in private practice in my hometown, Fairfield, Connecticut, since I got out of my residency program in 1983. So I've been in practice 40 years. I'm also in academia, and I've been teaching at NYU since 1984. At the University of Connecticut School of Dental Medicine, I teach the residency program there. I've been teaching there for 20 plus years. I've been at Yale, teach all over the country, all over the world, actually. I probably teach 1 or 2 days a week somewhere. I've been writing. So I think education is a very big part of it. Being mentored and mentoring others. I mean, that's the way it works. You pay it forward. I'm paying it forward for all the giants that taught me. Almost everything that I've learned from other people. I'm well known as a practicing periodontist. There are only 6,000 periodontists in the country, yet we have an epidemic of periodontal disease. 50% of the population is periodontal disease over the age of 30 and over the age of 60. you're at about 75%. It's an epidemic. We have almost 200 million people with untreated periodontal disease in the United States, and people aren't treating it. And it's not being diagnosed because it doesn't seem to be a big problem until it is a big problem. So 10 to 15% of the population will lose their teeth due to bone loss without treatment. But the rest of the population will just get some form of bone loss. And it may not be symptomatic like hypertension or diabetes until it becomes a problem. So we're very comprehensive in our approach. We treat the whole patient. And I think that's very important. And I've been lecturing for years, and I'm well known as a dental implantologist, a guy who does bone grafting and soft tissue grafting, and all the techniques. I've written a textbook on bone grafting that's been published in 4 or 5 different languages, and that is what people want to listen to me talk about. And I've been talking about this for years, but I also think what's more important is talking about the nature of the relationship between the doctor, doesn't have to be a doctor, any healthcare provider, you're an EMT, that really we talked a little bit about how you can relate to people. It's real important that you treat people nicely. And that is how I built my practice. My patients really don't know if I'm any good. How do they know if I suture well? How do they know where I graduated my class? How do they know how many millimeters of bone I regenerated? They'll know if they're right in the front of their mouth. They'll know if they felt any pain. But what they are going to remember is how they were treated and how we made them feel. They really don't care how much we know until they know how much we care. That's an old expression. So they want us to care for them, and that's what my book is about. It's based upon hospitality. And I come from a restaurant background. My dad had a small business in Bridgeport. I delivered furniture, I refinished tables, but I also worked in restaurants as a server, bartender, short order cook, cocktail piano player. I was a lifeguard where I had to serve people on the beach. So I've always been in the service industry, and I started to pay attention on what that felt like to be a customer and also to be someone who's giving the service. And I relate very well to the restaurant model. So my office is based on the same principles that you run a great restaurant. So in a great restaurant, there used to be a book called Zagat's. I don't know if you ever remembered it. It was a guide to restaurants that had 3 things: food quality,
Oh my gosh,
service,
yeah.
and decor. And it was
Yeah.
bought by Google. It's not around anymore. But that's how I judge restaurants: the quality of the food, what's the decor like, and it's how it smells, how it looks, how it feels. Is it clean? And the service. And the service is the human relationship. Some people will go to a restaurant because the food is really good, but the service is bad. They go, well, the food's so good, it's okay. But most of it, you've got to have the whole package. Now, personally,
Yeah.
what's most important to me is
Yeah.
decor because I have OCD and I'm a little bit of a neat and clean freak. That's sort of good for my job because I
Mhm.
do little things. And if the restaurant is dirty, I walk right out. I usually check the bathroom right away before I order food. And that's important. But the food's also important. So, how does that relate to a dental practice? We don't serve food, but we do serve a product. And the product we happen to serve is dentistry. We whiten teeth, we take out teeth, we do bone grafts, we do implants, we do Invisalign, we do dentures and orthodontics. We also do other things too. We talk about general health and your oral systemic link because the mouth harbors all sorts of bacteria, billions. And the mouth is also one of the cofactors, if it's not healthy, in a lot of the diseases that we get. Periodontal disease can lead to problems with diabetes, coronary artery disease, dementia, stroke, all sorts of low birth weight babies. And there's all sorts of problems that are there. So that's a big part of it as well. In my practice, I realize that patients don't know what kind of dentist I am, but they can see what the place looks like and they can see how well they're treated. So I train my entire team to have the same philosophy that I have. I'm going to tell you the training. It's 4 words: be nice to people. That's it. It's the golden rule. If you are nice to people, then you're giving good service. So how would you want to be treated? So that's sort of like where I'm at today. And after practicing for 40 years, I've been around for a while. I graduated dental school in 1979, so I have a long career. I feel at this point in my life, it's important for me to teach, my students and the people who come to my programs, not only how to do the procedures, because, I don't want to just be a procedurist. I want to be someone who's a humanist. I want to teach people about how to treat people properly, and that's important. And that's never taught. There's not one course in dental school about how to treat people nicely. There's not one course about the emotional state of a patient and how it affects their healing. Really, there's no course on even the oral systemic link when I went to school. I mean, it was all about doing procedures.
You're hitting a lot of key points because one of the things that you did state, you said hospitality is present when something happens for you. It is absent when something happens to you.
Yeah.
Those simple prepositions, for and to, express it all. That's exactly what you just expressed here.
Yeah. My book is Amazon bestseller. I've been up and down, but right now there are over 8 50 million books on Amazon. And my book is number 99 on customer service, which is
Awesome.
number one, but that's sort of a big deal. And
Yeah, it is a big deal.
the book that's number one is a book called Unreasonable Hospitality. And that was written by Will Guidara. And Will Guidara owned a restaurant in New York called 11 Madison Park. So my mentor in hospitality is a guy called Danny Meyer. Your listeners probably don't know Danny Meyer. Most people don't. He's the most successful restaurateur in the world. And he started with Union Square Cafe, Gramercy Tavern. And these are all New York restaurants, 11 Madison Park. And he's got about 15, 20 restaurants in there now. But he made his money not in the restaurant business, but when Shake Shack went public. So he created Shake Shack. And that's a whole story in itself. So everyone knows Shake Shack. So he's now close to a billionaire because of Shake Shack, not because he ran a great restaurant. But he's one of my mentors because his restaurants are run perfectly. And I believe that quote that you gave about hospitality comes from him. And his protege, Will Guidara, talked about the difference between service and hospitality. He goes, service is black and white, hospitality is color. And you can feel it. If someone just throws down the steak in front of you versus here's the steak and they come back, how was it? And they put it on from the right side. They don't reach across, they go around, they get out of your way. One of the things that I do in restaurants is I'm going to the men's room, especially a busy restaurant. Are they going to get out of my way as I'm going, or am I going to have to wait for them? Or are they going to try to rush by me? Are they going to respect the customer? Because you see that all the time. It's called the little things. And in practice, now this, by the way, my book is a book about treating people, not patients, for healthcare providers. These principles apply to any business in which people are involved. Whether you are a car salesman or, some of the greats in there like Jack Mitchell, who owns Mitchell's in Westport, Connecticut, one of the most successful retail chains in the world. He has a book called Hug Your Customers, whether it's there. He has those principles, whether it's in Stu Leonard's, one of the busiest grocery stores in the world. And they give you phenomenal experience. You never get a great experience at a big grocery store, but you go to the Stu Leonard's, you'll remember it. I don't think they have any down there. They may have.
We call him Tom Leonard. That's interesting that you mentioned it. It's Tom Leonard's down here.
Oh, Tom Leonard's?
Yeah.
Maybe his brother.
I read something about it that it was Stu, but now it's Tom or something of that nature. And I'm going to be honest with you. As soon as I walked into that grocery store, they consider it a market because the layout is a market.
Right.
You will never forget it because of the pattern that you go through.
Exactly. When you walk into the market, is rule number one, the customer's always right. And
that's the first thing you see.
Yeah. Rule number two, reread rule number one.
Right.
So it's,
yes.
It's nice when you walk into the grocery store. It's not always true. My patients aren't always right. When are they wrong? When they abuse my staff. So once they abuse my staff, my team is more important to my patients because the team is what serves them. If I don't take care of my team, that's a whole other topic, team building and all that, which is one of my favorite topics. What I love most about my practice is building a team of servants, servant-hearted people that help people, with integrity, which is so cool.
I went to your website. There are terms for the websites, and yours fits the website of making sure I go through the entire thing. There is a pattern that goes through, and there are books on it, and there's one specific book that focuses on it. But I got to the types of speeches that you provide to the public, like which one would best suit you. Right. And you go through so many. And even though you have several talks that you can give that are about dentistry, your first one was the one we're going to be talking about most today. And it has so much. I want to ask you this one thing. It says, let me be of service to my team and patients. Please help me be the gift.
Yeah.
That was on page 33. Something about that just resonated.
Yeah.
Please help me be the gift.
Yeah. Well, you seem like a spiritual person to me. And all literature, spirituality, no matter what religion you are, spirituality and religion can be similar. They're not always the same, but spirituality is a little bit different. If you're a spiritual person, I think, you want to be a good person and live an ethical life. What resonates most with me with all of those teachings is if I can be of service to others, that's the greatest gift that I can give to them. It also, the irony is the more I give, the more I get, so by giving to others. And so when I walk into my office every day, I have a little ritual and I'll walk up the steps and I have these two big plants on either side. And I say, it's showtime. As a Broadway actor, I'm not a Broadway actor. I'm a frustrated actor, but as a Broadway actor,
it's okay.
You can't have a bad night. So if you bought tickets to go see Hugh Jackman on Broadway, he's there for 6 weeks, and you bought tickets and you get there and Hugh Jackman says, I stubbed my toe in the bathroom and my throat's a little sore. I'm not going to sing tonight. I'm just going to talk through it. No, you can't. You're there. You're not Hugh Jackman. You're a performer on stage. I was taught that by Myron Finkel, one of my first mentors, who I just had dinner with last Saturday. I hadn't seen Myron in 40 years. Every day I think about him because he was the first job I got in private practice when I was 27. And every day we walked in his office and he said this. He goes, Michael, snap his fingers. He goes, showtime. And we treated a lot of Broadway actors and a lot of people because it was an Upper East Side apartment that we worked out of. And I was 27, this young kid. And he said, showtime. He goes, it's never about you. It's always about the people we serve, our patients. They don't want to know if you're sick or not feeling good. Don't tell them about your story. Don't tell them stories unless you're making them feel better by telling them. You want to be there to serve them. So I have this little ritual that I perform. And the first thing I say is showtime. And over the last 10 years, I added, let me be the gift. So when I walk up the stairs to my office, I enter the back door because I walk through a door, and on the other side of that door is my team waiting. We have a morning meeting. So I open the door, and it's like I'm walking on stage. So I play this in my head. It's showtime. Let me be the gift. And my whole team knows this. Everybody there's. I do a YouTube channel. It's every Wednesday. It's on my name at Sonick. And every Wednesday, I will give a 15-minute or 5-minute or 10-minute blurb on one aspect of what it's like to be the gift to my patients. I end every one of my podcasts with, let me be the gift, or you be the gift, because that's the greatest thing that we do. I'm Jewish, but the Catholic prayer, the prayer of St. Francis of Assisi, it ends with, let me be of service to you. Okay. It's very irony, when it's darkness, let me bring light, when it's hate, let me bring love, and let me be the gift to others. Let me be served. It's not like I want the gift. So in my prayer practice, I never go up there and ask. There's something out there. I don't know what it is. I'm not a religious person, but I never ask for anything. I always ask to be in alignment with these spiritual principles so I can serve others. And I'll tell you, it's a great business practice. Okay. I'm booked 4 months in advance. I've never been not busy. I'm a fee for service practice. Yeah. I don't take insurance. I submit it. And it's always about giving service. And if patients can't pay, I treat them anyway. I figure out a way to make it happen. I work with the patient. So nobody never leaves my office. I'm in Fairfield, Connecticut, which is next to Bridgeport, which is one of the poorest, where I grew up, the poorest cities in the country, and next to, Fairfield County, which is one of the richest counties. And so I have people from all walks of life. I say people take the bus or they'll take the limo, come in and see me. It doesn't matter. They all get treated the same. We don't have different quality levels of care. We're serving the people that come into our practice. And as long as they're appreciative and show up and, do what I ask them to do to keep their mouths healthy, we take care of them. And it's sort of cool. It served me well and it served my team well.
Okay. So are you familiar with Jim Stovall's book, The Ultimate Gift?
No, I'm not.
Oh, it's a very, very, very short book. Some of the principles that you stated of your practices is what he talks about, but there was a process in which this young man had to go through. But it's really interesting because I use the term gift a lot when I speak to my friends, because I don't say religious like you say, but I'm spiritual. I do believe in power. And I believe that before I even walk out my door, I literally say, allow my voice, my hands to be of your service so that I can be what you wish for me to be to help others. And I think that's a part of the hospitality of what you do, that hospitality of how you practice. So how can we take it so that other healthcare professionals can shift from their focus, the disease focus, to a person focused approach? Because that's very clinical oriented.
Right. It is clinically oriented. Simon Sinek, I don't know if you know who he is. He wrote the book, What is My Why? He's got the third most watched TED Talk of all time. And he talks about, what is your why? And what the why is your purpose. A lot of people are talking about that today. So why do you go to work every day? Then he talks about, there's the what and the how. So what do I do? Okay. If you meet a dentist or a physician, they go, I'm an internist. I prescribe medications. I mean, it could be very simple like that. Or an EMT. I pick up bodies on the street. I start IVs and I put them into the back of a car and I get them to the hospital so someone else can take them. That's the what that you do. The how that you do that is an EMT school or dental or medical school. That's the what we do. And a lot of dental colleagues of mine, that's what they do. Their what is like, I want to do 2,000 implants a year. I want to make a lot of money. My what is I want to make money. I want to put but that's not my why. That what may be your why, but some people's whys who do what I do, because most people who do what I do are very, very technique oriented. They're very detail oriented. They love to do stuff. They maybe tinker with cars on the weekends and then they just tinker with mouths during the week. So a lot of surgeons are like that. And so their what is actually, I love to do surgery. And if I talk to a lot of my students, They'll just teach me how to do surgery. What you're talking about, the spiritual stuff, this connectivity stuff, I don't want to hear about that. Actually, my book started because one of my residents who was really smart, she said to me, she goes, why do you need to talk about connection? Why is connection important? Connection of the people. I said, it's the most important thing that we do is to connect with other people. So my why is not doing surgery. My why is to improve the quality of my patients' lives. So that's my why. So when you're very clear with your why, then you can do the procedures. Yeah, by the way, I do implants, I treat infections, I take out teeth, I do bone grafts, but that's not who I am. And that's not why I go to work every day. I go why every day to improve the quality of lives. I need to be good at those techniques to do that. So how do you teach that? Well, this is something I've been talking about with one of my coaches because we're trying to get this information out there. And my book was published a year ago. It's got about 2,500 copies out there, which is very good for a book. Most books aren't even close to that. Most books don't sell more than 100 copies. And I'm giving one keynote a week somewhere for the
Wow.
last 6 months. So I'm out there, and my keynotes are not just 15, 20 people. They're 2, 3, 400. I've talked up to 900 people on this topic. And it's starting to get a little bit of attraction. So how do I get more people to do this? Well, what's the hook to get
Yeah.
healthcare providers? I'm going to tell you what the hook is. It may sound a
What?
little perverse. The hook is money because that's what people want. Money, it's money. If I say, hey, you're going to make people feel good, big deal. If I say, hey, you'll make more money if you're nice to people and you follow these principles, maybe get around to it. If I say you'll lower your stress, because most physicians and dentists, what they dislike most is the dealing with the financial aspect and dealing with their teams. Most of them don't like the people they work with. This is the biggest complaint I get. I can't get anybody to come to work anymore. Nobody wants to work since COVID. I
Yeah.
go, no, nobody wants to work for you since COVID. I go, because you're not happy, right? That's why.
Wow.
I have the best team I've ever had. It's the strongest team I've ever had. We've built it all through COVID. That's a whole other topic about how do you hire a great team of servant-hearted individuals that practice with integrity and are health-oriented, and work together as a great team. How do you put that together? There's a whole strategy for that. I have a whole chapter of that in the book, and I have a series of videos on how to do that as well. And it's worked really well for us. It took me a while to figure it out, about 30 years, but I have all sorts of strategies. It's very, very clear and direct. So how do we teach that? Tell them that's going to do the two most important things. It's going to make you more effective, and it's going to
Mhm.
decrease stress. I look at everything through that lens. Is it going to increase or decrease stress, increase effectiveness or decrease it? And effectiveness may mean more money. It may mean more patients. It may mean doing more procedures. Whatever means doing more procedures with less complications.
Mhm.
Because I see all sorts of complications. I was talking to somebody this week. I have a study club with 18 periodontists that are all very well known. And one got on and started complaining. They didn't want to share this because we share our weaknesses there, our vulnerabilities. And
Mhm.
there's one younger periodontist goes, I'm getting a lot of postoperative infections. So everybody's going through, are you using antibiotics? Are you doing this? Or do you have a new person sterilizing instruments? Well, what we found out was this is a busy, busy practice, and they only had one autoclave for the whole practice. Now, to put that into perspective, my practice is the same size. We have 4 autoclaves. They probably shoving all the instrument most likely in one autoclave. It's silly things. Now, if they were a little bit more, worried about the concern of less complications and more effectiveness and decreased stress, they would have bought 2 or 3 autoclaves, but they were being cheap, most likely.
Yeah.
That's what I think. That's
Mhm.
my judgment of that. I didn't say that to them, but when I found
Yeah.
out that they only had one autoclave and everybody else on the call had at least 4, one guy had 12 autoclaves. So we want to be able to do what's right for the patients there. I don't know. It's very hard. I was on the phone with a therapist last week who's one of my coaches. She's not a therapist anymore. Now she's a coach. She says,
Mhm.
what I wanted to do when I was in my graduate program was do preventative psychiatric therapy. And my coach at school said, good luck. Nobody wants to do that. Everybody wants to fix the problem. Nobody wants to prevent the problem. It's
Wow.
more important to prevent the problem, right? When do most people go to the doctor? After they have a heart attack, after they have a stroke, oh, I got to take care of myself. I have skin cancer. I sit in the sun with no covering for the last 30 years. So now I'm not going to go out in the sun. You want to do the prevention. That's what dentistry talks about. But
Yeah.
between you and I,
Yeah.
dentists don't do it. They want to do the procedures. Why do they want to do procedures? Because when they do a procedure, that's when they get paid.
Yeah.
Okay. Well, if I tell you to brush and floss and get your teeth cleaned every 3 months, I'm not going to make any money. All right. Because you're going to be preventing problems. But I don't want to make any money by doing prevention. There's plenty of people that are not going to follow my advice that I'm going to be busy anyway. But at least the people that I can advise will not have a problem in the future. I call that fixing the leaky roof. you're an EMT. So
Mhm.
I'm going to say 100% of the people that you pick up on the street, if they practice prevention, it wouldn't have happened. Okay. If they wore the seatbelt. Okay. If they looked both ways, if they didn't drive drunk. Okay. They didn't turn around in the car. They didn't look at their cell phone. If they took care of themselves, then they wouldn't have had the massive heart attack. The people that have these massive heart attacks, they're usually not really in great shape people. They're usually people who aren't taking care of themselves. So I think that the biggest failing for human beings, not doctors, not dentists, not healthcare providers, every human being, is we are short-sighted. We want immediate gratification. And if we do
Ooh.
the things that are real important, we will not
Mhm.
have all those problems. Every
Mm.
problem in the world, every war problem, pollution problem, global warming, all
Mhm.
due to being short-sighted. We still don't take
Mhm.
care of them. It's not bad enough for us to start taking care of them. We want artificial intelligence to save us or science to save us. Maybe they will, maybe they won't. I don't have the answer to that one. But for human nature, we are short-sighted. And so can I teach people to look for the long game? Or do they
Yeah.
want to get the first quarter profits, like most businesses do? You got me going.
I know I did. I know I did. And
Well,
that's
that's
the
good.
reason why I wanted to read some of your book prior to seeing you because I was like, "Oh, I see I'm hitting him." What is it that he loves the most? And you love people.
Yeah, I love people. I understand them. They're all
Yeah, no,
flawed,
you love people.
myself
You've been in the
included.
business for a long period of time.
Yeah.
You mentioned Dr. Finkel, and if I'm correct, you met his son eventually. Is that the one
Yeah,
that you met?
I did. I did.
Yeah, and you had a good sit down with him as well.
Who I am is mentor. That's who I am. I'm a mentor to
Awesome.
others. So I want to share with other people to share some of the experience that I have so they won't have the same problem. By the way, we haven't talked about my problems. How do you think I got here? You name the problem, I've had it. Every problem.
Okay, that's where I was going. I have it on my list. I was going to say the last thing because I know I told you 30 minutes, but I want people to understand because I'm going to be honest with you. That's probably what stuck me for a minute because I was like, am I really reading this right? You went through a lot with your teeth.
Yo, that's my teeth. I'm talking about this the
And
philosophy. Yeah, my life.
okay.
I knocked my teeth out when I was 8. I fell over the handlebars and I had my 2 teeth went on the sidewalk and they were wired back in. My jaw was wired shut for 8 weeks. I had to drink through a straw and everything had to go through a food
Mhm.
processor. There were no food processors back then. It was 1961. It happened. Had 2 root canals and I didn't get my 2 front teeth crowned until I was 18. So from the age of
Mhm.
8 to 18, 10 years without front teeth. And since then, I've had all my teeth crowned. So I have 23 crowns. I've lost 9 teeth. Everything you're looking at here in my mouth is fake. It's all fake. Most lay people, probably yourself included, go, see, yeah,
They're
nice teeth.
beautiful. Now.
Yeah,
They're
they're
beautiful.
fake. They're all fake. Yeah. So when you're a good dentist, you know other good dentists, so you can go find a good dentist to treat you. Well, if you need someone good down there, let me know. I'll send you
Okay.
somebody. 4 years ago, I went over the handlebars again on my bike. It
Oh,
took 6
really?
years to have the second accident. I knocked out my front bridge. Broke 3 ribs, got a concussion, tore a retina, and I had to have them fixed again. So I've been through a lot. And all the stuff with people, I've been through a lot of experiences there with business. I have a very successful business, but I was bankrupt when I was 37 because I thought I was a real estate investor. I don't know anything about real estate, and I lost everything completely. And got divorced when I was like 39. Left the marriage with no money, no real estate, nothing. Had to rebuild everything all
Wow.
over again. Now I'm happily married for over 25 years, but I've gone through a lot of traumas, both mentally, emotionally, physically, spiritually. Been bankrupt. Emotionally and physically and spiritually a few times. The last 20 years, it's been smooth sailing. It took me to get into my early 50s till I figured it all out. And so when people come
Mm.
up to me, they look at me and go, "Oh man, you had a great life." I go, "Yeah, went through a lot of traumas, to get here." And I learned from them. That's the important thing, is not make the mistake over and over again. And so, with the young people out there, I always say, if you have a surgical complication, give me a call. There's not one I haven't had yet, because I've been doing it. And I've done, I don't know how many surgeries, thousands. I've probably done 100,000 surgeries, in my life. If you do a lot, you're going to have things go wrong. Now, very little complications. Everything's very smooth, but that's experience. You can't get experience from anybody else. You can only get it from yourself. You can watch, you can look, you can
Right.
get advice, but it's not
Right.
the same. I just became a grandfather. My kid,
Congratulations.
thank you. And I'm watching him, how he's worried about this, that. I'm watching him,
Mhm.
I'm not telling him. I didn't tell him I was going to like to be a father. Kid comes up, he goes, I feel this way. I go, did I tell you what it was going to be like? He goes, no, you didn't. I go, because I couldn't. I mean, you got to
Yeah.
experience it. You have to get the experiences of being a young father and figure out what to do with a kid that, needs to eat every 3 hours and cries when he's not eating and all that other stuff.
I just want to say thank you.
Thank
You
you.
have given us so many gems, and you have been a gift to Cold Press Conversations, providing such pivotal information about being a human and how we need to treat other humans. We have feelings, we all have thoughts, and we all want to be heard,
Yeah.
or at least feel like we're appreciated. And that is what your intentions are. And you're doing that. You are giving back Ooh, when one person gives back, it's almost twofold. It's almost like saying thank you for your blessings, because now if I didn't get that blessing from that person, then how is it that I cannot give it to someone else so they can
Mhm.
feel that type of love and that gift that I had? And that's what you're doing. And I thank you for what you're doing in dentistry, but you're doing it for public health so that providers, practitioners, clinicians can give appropriately, because that's what we're here to. We're here to serve them as well.
Yeah.
Yeah, I really thank you. I really thank you. Do you have a gem that you would like to leave with the audience today?
If you're feeling bad, which we all do, I'm a pretty upbeat, happy guy, but 5 or 6 times a day, I'm not. Okay. I'll look at an Instagram post and go, oh, or I'll see something or I'll eat something or, a human being will disappoint me. Okay.
Yeah. Yeah.
Just realize that everybody has their own agenda and nobody signed a contract with me that they're going to act a certain way. So I have to accept everybody that they're doing the best that they can. And I got to be grateful for my own life. When I live in a state of acceptance
Yes.
and gratitude, then my life is perfect. And I try to connect with that every day. I start every day, let me be the gift today. I start before I go to the office. I start every day, with a very short prayer, how can I be of service? How can I be in alignment and how can I be of service with others? So that's where I try to live, but I'm a human being. And sometimes I get upset and sometimes I look across the room and I'm thinking like, why are they feeling that way? Snap out of it, and people are just people, they do the best they can. I feel very fortunate. I feel very blessed. I have a little thing I do with my wife when we cross the street. I said, these are the good old days. I go, we're walking across the street unassisted because it's not going to always be that way. Right now
Ooh.
it's great. And I got to be very grateful for the life that I have at this moment. And I am.
Oh, you give so many gems. I really appreciate it. Viewers, this is one of our most wholesome cold press conversations where we hit to the nitty gritty of the soul of the individual. And I want to say thank you so much, Dr. Sonick, for all that you have done today. Sometimes we have to break it down. It's not always about the scientific part, but it's about the human side. And I think today we hit the human side of what our patients would love to have each and every day when they walk into an office to receive some service or to hopefully feel better. I just want to say this was an engaging opportunity with Dr. Sonick. I want everyone to please take care and remember that this is to your health and cognitive happiness. I am Dr. Jewel Williams, and I thank you so much for watching and listening to Cold Press Conversations. Thank you.
I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.